Hello, Wildlife Center of the North Coast volunteers. I thought for my next installment here in our volunteer informational kind of training slideshows that I would talk a little bit about wildlife rehabilitation and the limitations we have in terms of what animal care can address and potentially fix. I know as volunteers, a lot of folks have questions when animals come in about whether or not they are coming in with a condition or an injury that we're going to be able to help with. So I thought that it would be really useful for people to have a sense of what we can do and what we may not be able to do. What are the things that we might look at and say, hey, we can give that a try, versus the things that we know are beyond our limitations and are beyond the scope of our practice. So that's what I'm going to talk a little bit about today. So we can help babies grow up, right? And we do a lot of that. We can treat many injuries, especially minor ones. We can medicate for certain diseases, illnesses, relatively low levels of parasites in the scheme of things, those kinds of things. So a lot of what we see come in really is in this category or in these categories where there is something that we can do. But because of a lot of things, because we're a small center, because we are geographically one of the few centers in this part of Oregon that are available to people, so we're taking things from a broader area, we do get a lot of things that are beyond the scope of what we are able to do here at the Wildlife Center of the North Coast. So how do we decide what is and is not treatable here at the Wildlife Center of the North Coast? And I think it's important to kind of emphasize that a lot of those decisions are made based on what are considered best practices, and not just best practices by us, but generally best practices by the community of wildlife rehabilitation professionals that are out there and the people who are doing education in the field and are doing training in the field. And that those are the standards that we look to when making decisions about how best to care for an animal and how best to treat an injury. So here are some examples. And the examples I decided to include here are sort of the standard examples that are offered by the International Wildlife Rehabilitation Council. And there are some nuances here, but I think that the ideas that they put out there are really solid in terms of giving people a basic landscape to operate within, to understand decision making around when to try to intervene and use animal care to rehabilitate, and when that's not appropriate. So the first thing would be when an animal is already showing signs that it's in the process of dying. So if an animal comes in and its body posture and its breathing is clearly indicating that it's on its way out, that's not a time when we want to try to prolong the animal's life, because it's not going to be effective and we're just potentially going to cause it further stress, right? So it's not something that we are able to do because we know it simply won't work. Another time when we may have to decide that we are not going to do care for a specific issue or illness is if it is happening in combination with a bunch of other injuries or issues. So if an animal has multiple significant injuries, typically its prognosis is not going to be very good, and that might be a time where we say, hey, this really goes beyond what we're able to address here. That would certainly be something that would be a case-by-case basis. But in general, the IWRC does recommend really evaluating cases where an animal has multiple significant injuries carefully and trying to make the best decision for the animal, knowing A, how difficult it will be for an animal to heal from multiple severe injuries, but B, also how long that animal might have to be in human care as a result. and what kinds of other problems could pop up just as a function of being in a rehab setting with human beings and an unnatural environment for a long time. Spinal or head trauma or nerve damage would be other things that sometimes are just beyond what we can help an animal heal from. This is, again, an area where we're going to evaluate and make decisions on a case-by-case basis. So if an animal comes in with what appears to be head trauma, but after a day, 2 days is making some improvements, then it may be that there's something we can do there. If an animal is showing symptoms of spinal damage, head trauma, nerve damage, and there's no improvement after about a week, it's unlikely that improvement is coming in the near future. And it means that you have an animal that has an injury that's beyond what's repairable in the wildlife rehab setting. This is one that's really interesting, that I know for myself, I was really surprised to learn about, and I think a lot of people maybe are, which is severe emaciation. That's often, something that happens because it's associated with some kind of underlying condition. But if an animal comes in really severely emaciated, it's often too late. The animal might be at a point in terms of how it's metabolizing within its own body that if you start reintroducing food sources, it can become really susceptible to something called refeeding syndrome. And refeeding syndrome is something that's not deeply understood, but it is basically a set of symptoms that arise when an animal starts being fed again after a period of starvation or emaciation, and it can actually itself be fatal. So there's something that happens with an animal when it's become really severely emaciated that takes it past a point where it's easy to reintroduce a diet and see improvement. Again, this is one where our wildlife rehabbers would really evaluate the animal and think about what the best next steps would be. But especially if there's an underlying condition, severe emaciation can be something that is just too difficult to address in this setting. If there's an underlying condition, that emaciation may potentially improve somewhat in the short term, but just continue to come back if that underlying condition can't be addressed. Lack of deep pain is an indicator that something's really wrong, right? And that's true for human beings as well, that if you have an animal that's showing lack of deep pain, what they're showing you is that they have some kind of damage to their nervous system that is impacting how their sensory system is working, and that's something that is really a problem if you're a wild animal. I think this next one is probably the one that we talk about the most, and that can be the most not counterintuitive, but like difficult to understand, and that is fractures near the joint. So while it's true that we do get animals in who have fractures and there's some ability to repair those fractures and have them heal and have that animal potentially be released, fractures near or through a joint are just a no-go. And as difficult as that can be to accept when you have the knowledge that there are other types of fractures that can be repaired, a fracture through a joint is never going to heal well, and that animal will always have persistent discomfort and pain as a result. So a fracture through the joint means never being able to live a normal wild life. And the whole goal of wildlife rehabilitation is to be able to release animals that can go on to live a wild life and feed themselves, care for themselves. And if an animal is in persistent pain, that's not something that they can do. Open fractures are another one where if there's dry bone exposed, then we know that that bone is dead and is not going to be able to heal itself. But open fractures are also really prone to infection. Stuff can get in there. And when we say an open fracture, what that means is the skin around the broken bone is open to the air. And so open fractures are another one where it's just beyond what we're able to do for animals here, in part because of the risk of infection, because of the low potential for healing. It's just like a multifaceted situation. So an open fracture is another one where there's just really there's not anything that we can do. There are some insect infestations that are not likely to be treatable in our environment here. We do see other, and if you've been around for any length of time in the summers, you know that we see insect infestations. We see pelicans with pouch lice and things like that. And a lot of that is treatable. We can give, medication, we can do baths, we can pick the bugs off ourselves. We had to do that, with that cute little mountain beaver last summer where we picked a bunch of ticks off him and it cured his tick paralysis and he went on to be feisty and delightful and free. So some of those things we can do. But there are some insect infestations that get really bad. And if that's the case, you have a couple of things that happen. One, they can be very, very difficult to get rid of and have caused a lot of tissue damage. And two, the stress and pain associated with trying to get rid of them would be just intolerable for the animal. So, the IWRC definitely recommends, especially in the case of a really bad maggot infestation, as gross as that is to even consider, that rehabilitators take a very close look at whether or not it's possible to help with that situation, because that's often one where we can't treat it well enough for the animal to recover. And then the last thing that I have on here is just any injury that, even if healed, will prevent an animal from escaping from predators, from feeding itself, from reproducing, from being able to protect itself in the wild. Those are things that we can't just wave a magic wand for, right? Like those are things that prevent an animal from being able to live a wild life, from being able to be a wild animal in the way it's intended, potentially to be able to be pain-free. And as wildlife rehabilitators, we have a responsibility to look at those injuries and realize that if it is something that won't ever heal enough for an animal to be truly released back into the wild in optimal condition, it's not something that we're able to address here. And then the last thing that I just wanted to note was that some species just don't do well in care. Swifts, for example, as lovely as they are notoriously difficult to care for in rehabilitation. They refuse to eat and have to be force-fed every meal. Very tiny baby mammals, like the naked ones with their eyes closed, are really, really hard to care for. Hummingbirds can be notoriously difficult to care for. And all of this is the result of how difficult it is to feed these animals in care for the most part. So with animals like these, it's always going to be up to our rehabbers here, Ginger, Erica, to make choices about whether or not this animal is something that we can take in and adequately care for, knowing that some animals just don't thrive in the presence of people, that they're, truly wired to be wild, and that being in human care is enough of a stressor for them that it creates its own problems. So, this is a very quick overview of all these things, but I felt like because we had gotten a lot of questions lately about, what can we do and what can we not do? And, what animals do we try to treat, or what injuries do we try to treat and which ones we don't? I just thought that it might be really useful for people to understand a little more about why. and what choices we make. And, if anybody has any questions, I encourage you to definitely reach out. And I may not have the answer, but I can ask someone who does. All right, thanks.